Our research studies the question whether obesity is a trigger for early puberty onset in boys and girls. Then indeed there are quite a lot of observational data showing that obese girls and boys are prone to starting puberty developing earlier than other children. The data are more consistent in girls than in boys, and our studies taking a genetics approach looking at common genetic patterns in hundreds of thousands of men and women show indeed there's a strong overlap in the genetic regulation of obesity, weight gain and puberty timing. And again, these links are far clearer in girls than in boys. And as we know that early puberty timing is related to higher risks of diseases in later life, diabetes, cardiovascular disease, and also associated with some high risk-taking behaviors and poorer educational outcomes in the young people, we're advocating that trying to avoid early puberty timing may indeed be a relevant target for public health strategies. I'm trying to persuade people who are trying to manage weight gain in obese girls in particularly to measure puberty timing and see whether they can avoid early puberty timing. And there is some preliminary evidence that this is possible, and lifestyle behaviors, particularly physical activity, may have an impact on avoiding puberty independent of BMI. If this transpires, then eventually, hopefully, the message for parents may be to encourage physical activity, other lifestyle changes, which may be beneficial even if weight loss doesn't happen or BMI doesn't happen, still may be beneficial both in the short term and in the long term.